name is Julia Barron, and I'm going to be your Bellarmine University nursing student today. I'd like to come in and introduce myself to you and just find out your name and date of birth. Alan Abdullah, and your birth date is December 18th, 1948. Nice to meet you. I'm going to be here taking care of you today with your nurse, and I'm going to be doing a skin assessment. It should take about 10 to 15 minutes, and when I'm done with that, I am going to explain my findings to you and then let your nurse know. So just first, I just like to go ahead and just shake your hand and get to know you and look at your skin, just generally, overall, your color and your appearance on both extremities bilaterally. Okay. And I'm going to look to see if I'm seeing any kind of lesions, freckles, moles, just general color throughout. And let's go ahead and look at your other leg as well. Good. And looking at your chest, and I can turn you over to your back when we're done in order to check posterior aspect as well. So after I look at the general appearance, and I see that your skin tone is even, you do have some random freckles, and we're going to say that on your left wrist, you do have a lesion noted, and this will be the one that I'm actually going to describe when I am talking to the students today. So your skin is warm, there's no erythema noted. I can check for moisture as well, and I'm just going to check on your skin. It's important to note that if you had any large skin folds, I would be separating those and looking. And if I'm going to move towards any areas that I'm concerned, I may find moisture, like armpits, the perineal area. This is a great time to just go ahead and put gloves on. That way, as I'm continuing my examination, I can look in those areas as well. So I'm going to do that. And I'm still able to do a lot of checking for smoothness and checking the groin area, making sure there's no erythema or moisture. It's those areas where items like to hide that are the worst. Okay, so check for diaphoresis, any signs of dehydration. I can go ahead and check right away on the clavicle, pinch up, and I can see that it's smooth and elastic and resilient, and it goes back down. For edema, pitting or non-pitting, I want to look at those lower areas. So I may see edema in the heels, the posterior aspect. If my patient's legs are down, I might see it in their feet as well. So I'm just going to ask you to reach for that rail gently and turn yourself over and make sure that we don't have any edema posteriorly and that the skin is intact, it's warm. Checking the back for any freckles or any area of a lesion noted, and it's clear. Thank you so much. We already looked at mobility and turgor, and I mentioned it was resilient. There was no tenting noted. Hygiene, I looked at that when I pulled back and checked in the perineal groin area, and you can check the armpits to make sure things are looking good. No vascularity or bruising noted. So when I look at the lesion on the forearm, what I would want to note is the color, and when I'm looking at that lesion, I want to be able to describe it. So I'm going to say that this lesion is patchy, it is red to brown, it is flat, it has ill-defined borders, and it is on the arms and the legs, itchy, red, and it seems that it's in contact with the patient reported that he'd been gardening the week before and that he'd been around some leaves that had leaves of 3, and that he had this lesion appear right after that, and that it was really itchy and he scratched it. So I can see that it has some dry areas, and it has what appears to be some old red papules that he noticed over the last 2 days. So it's in various stages of healing, and there's some dried secretions on it, but there's no moisture on it right now. So that would describe my lesion. And I'll have that picture available for you to look at. Go ahead and look at your patient's hair. I want to look at it. I want to see my color. Is it fine? Is it thick? Try to look through it in a few places in order to see if I'm seeing any kind of infestations or brittleness with the hair, if it's coarse. Looking at the eyebrows, and I don't see any lesions, and he does have beautiful eyebrows as well. So moving down to my nails, let's go ahead and peek at the nails, and even on initial inspection I can look at that, but go ahead and pinch them, look at the angle, so 160, no clubbing noted, and I can see all aspects of the nail, pink, blanch as well. The skin, again, feel that warmth with the back of your hand as well, and I'm using the tips of my fingers, asking my patient if he has any issues other than the lesion, and he tells me no, he does not. So the nails are smooth, they adhere to the nail bed well, and there's pink and there's no cyanosis noted. The cap refill, when I'm pinching that, I want it to be under 2 seconds, which it is, so that's perfect. And there's no tenderness noted. So thank you so much. I'm able to get that skin assessment done, and I will let your doctor know about the lesion on your left wrist and on your legs, and that has been present for over 2 days for you since you were gardening, and we'll see if the doctor has something that we can utilize to treat that. So thank you very much. Go ahead and take my gloves off, and I'll use my hand hygiene. All done.